The Connected Care Halton Ontario Health Team and Halton Healthcare have released a new primary care action plan, with one of the main goals being that every Halton resident has a primary care provider, aka everyone has a doctor. I spoke with Zoe Dawe, Executive Director of the Connected Care Halton Ontario Health Team, to find out a bit of background on the plan, but started the conversation asking about how many Halton residents do not have a doctor.
Currently, we have about 41,000 people living in our communities of Halton Hills, Milton, and Oakville, Jason, that do not have an ongoing relationship with a family doctor. And so we have a big opportunity here through our plan to connect these people to ongoing primary care.
And what's the reason for that? Is it just because, we do hear doctor shortage, but then on the other hand, I've gone by places and I've seen accepting new patients. So is it just a matter of not having a doctor, or not finding a doctor, or wanting one?
I think you nailed it with not finding a doctor. I mean, we are very fortunate in our communities. We actually have really good availability of doctors willing to accept patients and accept patients from all walks of life. And so I think that in and of itself is going to be really helpful for us as we start to take the steps to implement our action plan. But your question around why don't people have doctors is that people think about healthcare in different ways. And we also know through health inequities, those very sandwich boards you referenced, the person who needs a doctor may not have access to transportation to drive by that sign to know their doctor is. They may not have access to the internet to look and find and search. We don't always have the simplest ways. And so through our plan, we're really committing to find people in our community in natural places where they are. Think about libraries, schools, community centers, Halton Multicultural Council, where we can meet them and talk to them about how we can help find them and their family a doctor so that they can get ongoing care throughout their life, whether they don't have a need now or have a need that's unmet.
So to do that, are you actually putting people in those places, or is it a matter of pamphlets, or what is the action of the action plan?
Yeah, I think a little bit of all of that, Jason. I mean, we know people receive information in different ways, so we'd be remiss to just kind of have a one size fits all. We also know that English isn't the primary language of everyone that lives in our community. So making sure we're working with organizations, translating materials in really simple language. We say often in healthcare, we use acronymese. We use a lot of short terms. We use a lot of kind of indirect language that for those of us that work in healthcare, we learn to understand what that means. And so, yes, pamphlets in libraries, leaflets that can go home with kiddos when they're registered at school. Our school boards do an incredible job with newcomer families to come in and that welcome part and how we can connect all of them to primary care. Certainly using the internet, Health 811 for those that aren't familiar with that. 3 digits to call, and you will speak directly to a healthcare coordinator who can connect you to a primary care practitioner, and our Healthcare Connect waitlist, which is a provincial initiative through our government that will guarantee you access and supportive access if needed to a primary provider near you.
Now, I've been very fortunate. I had a doctor when I was a kid. That was my grandfather's doctor, and then when he retired, it rolled over to a new doctor. So I've never been without a primary care provider. But I think there are a portion of people out there that would just say, like, "What do I need a doctor for? There's a walk-in clinic, or I'll just go to Emerge." What do you say to those people? Because they're
Ah,
out there.
yes. Well, let's tackle that twofold. So, yes, walking clinics exist and they're there for a purpose. Sometimes we don't know we have a need at 10 in the morning that we might fall and need something by 1 in the afternoon. But that walk-in clinic can provide you with something right here and now, but it doesn't help shape the journey to other things that may not yet be known. So we're really encouraging everyone in our communities to take advantage of this plan so that even though you might feel healthy today, you have that really strong protective relationship with a doctor that when you need it, they can follow your care. You also mentioned, why wouldn't I just go to the emergency department? Our emergency departments are critical resources for our communities. They're 24/7. They have a dedicated team of some incredible healthcare practitioners, but we really want to reserve those for those with emergency needs. Right. And we talk a lot about wait times for emergency departments, and nobody should be having their primary care health needs met through an emergency department. You should have a place where you can go, where you can call, and ideally get an appointment same day or within the next couple of days. And that's what we're really striving to achieve through our primary care action plan.
All right, so one more time, if people have seen this and are like, you know what, I do need that doctor, I do need that primary care, what is their first step?
Sure. So their first steps, I always think simple is best. Call Health 811. Tell the nurse that you're speaking to where you live and you're looking for a healthcare provider, and they'll help you with those next steps. And I can say to you that that will absolutely ensure that we will see you through to being attached to a doctor in your community in a location that suits you.